Hello everyone, I'm Dr. Ankit Khandelwal, your Faculty of Anatomy at NExT. So here's a quick image-based question. The question says a 71-year-old man comes to the physician because of involuntary shaking and gait abnormalities for the past year, right? So the problem over here is shaking and gait abnormalities. He also reports depressed mood and diminished smell and taste. Examination shows a shuffling gait, resting tremor in left hand and the rigidity in both arms. The patient is most likely structural changes in which of the following labeled areas of the brain, right? So in the question you can see this image over here. Here there's a coronal section of the brain. Now these all findings, they are referring towards some of the basal ganglia abnormalities, right? So something related to the basal ganglia. And here shaking, involuntary shaking, gait abnormalities, shuffling gait, resting tremor, both the hands, they are pointing out to the Parkinson's disease over here, right? In Parkinson's disease, we know it's a defect, anatomical defect of the nigrostriatal fibers, that is the substantia nigra, which has a dopaminergic neurons. So in this coronal section, can we identify substantia nigra? Now we should be knowing that this structure known as substantia nigra is present where? It is present at the midbrain. And midbrain is present where? It's part of brainstem. It is located just below or just inferior to the diencephalon, to the hypothalamus and the thalamus part. Now if you look over here, we realize that this area, if I may highlight it, this area is the area for the midbrain, right? Therefore option number B over here, if I enlarge it, refers to the area of the substantia nigra. And therefore in this question, option B would be our best possible answer over here. If you look at other options as well, we should know this image is very important and it is frequently asked as an image-based question. Option number A over here, this represents the thalamus region. It's a part of the diencephalon, the thalamus. Option number B is the substantia nigra, which is located anatomically inside the midbrain, but functionally is a part of the basal ganglia or basal nuclei. Option number C over here is the caudate nucleus, and again a part of what? Of the basal nuclei. Option number D over here is one of the projection fibers of the CNS, of the brain, and that is our internal capsule. So this is the internal capsule. That is one of the examples of the projection fibers, the white matter. And lastly, option number E over here, option number E is present a bit more laterally, and therefore it's a part of what? It's a part of the putamen, right? So it will be part of the putamen, present more on the lateral side. Okay, so in this question, the answer over here is option B. It's a clinical case of Parkinson's disease, and anatomical structure over here is substantia nigra, located anatomically in the midbrain, and this is a coronal section of the brain. I hope you liked it. Thank you very much.